Weekly data released by the Centers for Disease Control and Prevention, the CDC's new findings show a relationship between people who've been diagnosed with the coronavirus and on-site eating and drinking.
Specifically, the report found that adults with positive test results were approximately twice as likely to have reported dining in a restaurant than those with negative test results. Western Mass News is digging deeper into the correlation between the two. A recent report from the CDC looks at close contact exposures within the community contributing to the spread of COVID-19.
Anytime you take people and get them closer together, especially if they're not following mask guidelines and social distancing, you're going to see more cases.
Massachusetts was a participating state with patients sampled from both Bay State Medical Center in Springfield and Beth Israel Deaconess in Boston. The investigation also looking into 9 other healthcare facilities across the U.S. and positive versus negative cases. The results? Those with positive test results were dining at restaurants more frequently. Western Mass News is getting answers on the study's findings with Dr. Jonathan Bayek, president of Allergy and Immunology Associates of New England.
You put yourself into a room with a bunch of people, whether it's a restaurant or a bar or a coffee shop, and you're surrounded like we did before this pandemic hit, you're going to expect a lot more infection.
In response, the National Restaurant Association pointing out the study fails to distinguish the types of venues which could have different atmospheres contributing to the spread, like whether participants dined indoors or outdoors. The study also doesn't show a direct correlation that the cases themselves are coming from restaurants, something Dr. Bayek says is tough to do.
Most of the time, it's very difficult to find out where somebody got it, where they got it.
This as many restaurants continue to struggle. John Thomas, managing partner for Max's Tavern, says they're following every precaution put out by the CDC.
Everything that comes out impacts the decision on whether or not the guest is going to come out to the restaurant. But we got to do something, and there's no way we can just sit at home and stand in place for that long.
The CDC's conclusion following the investigation stating, quote, eating and drinking on-site at locations that offer such options might be important risk factors associated with SARS-CoV-2 infection. Efforts to reduce possible exposures where mask use and social distancing are difficult to maintain, such as when eating and drinking, should be considered to protect customers, employees, and communities. Max's Tavern ensuring guests are distanced and protocols are being followed.
I've been trying to exceed every guidance that we possibly can to make sure it's safe for our guests and our employees.
Dr. Bayek says in his experience, restaurants are doing a great job.
So I don't necessarily think that people should not go to restaurants, any more than they would before hearing this type of information.
Moral of the story, practice social distancing. If you go to a restaurant, wear your mask, sanitize, and make sure that those around you and the place that you're dining at are doing the same thing.